My name is Alejandra Lipschitz. I'm the Communications Coordinator for Global Projects at Healthcare Without Harm and Global Green and Healthy Hospitals. We have three presenters from South Africa, great presenters from South Africa today, that Lukman Yusufu, the GGHH campaigner for groundwork in South Africa, is going to be introducing. And our International Science and Policy Coordinator at Healthcare Without Harm, Ruth Stringer, who will be our main speaker and panelist, and then we'll be hearing examples from our members in South Africa. I'll start by introducing Global Green and Healthy Hospitals very quickly to those that are joining us today. Some of you, from what I can see in the attendee list, are already members. For those that are not members, this webinar will be an opportunity for you to see what GGHH is all about and what our members are doing in waste, particularly in South Africa. Global Green and Healthy Hospitals is an international network of hospitals, healthcare facilities, health systems, health organizations from around the world, and all our members are dedicated to reducing their environmental footprint and promoting public and environmental health. The Global Green and Healthy Hospitals network is based on 10 interconnected goals that you can see listed here on the slide. We have 10 goal areas, waste being one of them, which is the one that we are focusing today. And our members are working in either one, two, or even more of these goals. GGHH hosts a series of webinar sessions on different goal areas. As I said, today focusing on waste. We hosted a session on energy last month. So we'll invite you all to subscribe to our newsletter list or to visit our greenhospitals.net website to stay updated about upcoming webinars in any of these 10 goal areas. We have 744 members from 42 countries. The countries that are painted or that you can see different colors are the countries in which we have members. I'll invite everybody joining us today to use the chat box to tell us where they're joining us from, so that we can see the variety of people not only attending the webinar, but also maybe already having joined GGHH. And Global Green and Healthy Hospitals offers different programs and benefits that you can see here listed on the screen. We have the 10-goal framework. We also lead the 2020 Healthcare Climate Challenge, which some of the people joining here, I think, are already participating in. We have the intention of protecting public health from climate change. We have released last year a brand new data center to measure footprint and track progress on sustainability, with self-assessments currently focusing on the waste goal, the energy goal, and the 2020 Healthcare Climate Challenge. We have an online global collaboration platform called GGHH Connect, a social media platform for members to connect and learn from each other, connect with experts, and learn and share questions on sustainability. We have an online education system, which is our webinar series that you're all participating in today on different goal areas and different documents for members. These are just a glimpse of the different guidance documents of the goal areas that we have. We have a guidance document for members on buildings, one on water, one on waste, and one on energy. And this is just a list and an example of the different webinars that we have hosted and that you can access by logging into our greenhospitals.net website or accessing GGHH Connect. Our greenhospitals.net website also lists case studies from members from around the world. I think we have over 150 case studies in English, in Spanish, some of them in Portuguese and some of them in Chinese, that portray examples of sustainability projects that are being implemented by our members in different areas of the world. So by joining GGHH, which is currently free of charge, members not only get access to the different programs and benefits that I very quickly went over, but you also get the opportunity to participate in different award categories, to receive certificates for your membership and participation in the network, to receive information in newsletters, or be highlighted in our newsletters, or to produce testimonial videos, as you can see on the lower right-hand side of the screen, with you and our members just explaining what your work is and highlighting what you're doing on the ground. Sorry, I'm going quickly because we have three presenters today, but I wanted to go to this slide. So if you're interested in becoming a member, it's very easy. As you can see, you just need to send your letter of interest to greenhospitals.net, and you can find a section that is called Join the Network. You download the letter, you complete it, and then.
Hello?
Lukman, now I'll pass the ball to you.
Okay. Hello, everyone. Can I go ahead now? Okay, so hello, everyone. My name is Lukman Yusuf. I'm the campaign manager for the Global Green and Healthy Hospital Network in Africa. And I would like to say thank you so much for making time out to join us today. We are delighted to have every one of you for our first series of webinars on sustainable healthcare waste management in Africa. I would like to start by introducing some of our colleagues, our GGHH champions in Africa, who are going to be presenting today. First on the list is Shireen Arends and Funeka Makaye. Both of them are from Grace Hospital. Shireen is a quality assurance manager at Grace Hospital, and she's also a qualified nurse since 2000, and she's specialized in critical care. And one of the things that they've achieved in Grace Hospital is the implementation of the national core standards, and she has about 91% overall performance, which is the second best in the country. Funeka is an environmental health practitioner, also over 4 years of experience working in Grace Hospital. And she's, together with Funeka, they've implemented the Global Green and Healthy Hospital Initiative, and they'll be sharing with us some of their achievements on waste management. Second on the list is Tshepo Patrick Mokhadi. He's from the Free State. He's also an environmental health practitioner with over 4 years of experience in healthcare waste management. Tshepo also comes with an award called the Alfred Unzo Environmental Health Performance Award, which he got last year. And that was based on his performance on environmental improvement in his hospital. Also, we have the Makatso Lapo. She's also a champion, a GGHH champion in Betaklawa Hospital in Gauteng province. She's a specialized healthcare waste management officer, and she's also very instrumental in promoting GGHH in the province. And today, all three of the hospitals will be sharing with everyone here some of their achievements towards sustainable healthcare waste management. I'm really looking forward to this, and thank you so much for registering and being part of this. Thank you.
Thank you, Lukman, for the introduction, and to everybody for joining us here on today's webinar. My name is Ruth Stringer, and I am Healthcare Without Harm's International Science and Policy Coordinator. One of my most important roles is to advise people on how to minimize and safely manage hazardous and infectious wastes. So I'm going to show you some key facts and figures which you can use to illustrate the importance of healthcare waste management and introduce some of the key strategies and solutions that you can use to reduce the dangers from waste in your facility. So did you know that approximately 60% of the healthcare facilities in Africa have even the most basic form of healthcare waste management? By this, I mean that only that waste is not burned in the open or dumped in pits. If you were to ask for a waste treatment that met international standards, the figure would be far lower. This means that over half of the world's population is now at risk from occupational, environmental, or public health threats from improperly treated medical waste. Failing to treat waste properly also violates people's human rights, including their right to a safe working environment, the right to a clean environment, and the right to life and health. You probably know that sharps are one of the most hazardous types of waste. But did you know how much sickness it could be responsible for? This slide shows estimates of the number of cases of HIV, hepatitis, and bacterial infections that are caused by unsafe injections and needle stick injuries globally. If you estimate that 10 to 20% of needle stick injuries happen during the disposal phase, including trash collection, then you end up with approximately 35 to 75,000 cases of HIV that are being caused by this aspect of bad waste management. For hepatitis B, the estimate is even higher, from 1.5 to 3 million cases caused by poor waste management every year. Stepping even further back and looking at healthcare waste in its broadest sense, this chart is from the World Health Organization's most recent and sophisticated estimate of deaths from environmentally related causes. Globally, almost 1/4 of deaths, 23%, are linked to the environment. Sub-Saharan Africa, circled here on the left, has the highest per capita rate of environmentally related deaths. Poor healthcare waste management can contribute to the communicable disease deaths, for example, by transmission of HIV and hepatitis B and C from needle stick injuries, as I've just explained. But air pollution from incineration and open waste burning can also significantly increase preterm birth, low birth weight and infant mortality, stroke, asthma, and cardiovascular disease. The burden of treating all of these diseases caused by burning waste and all of the infections caused by needle stick injuries and other forms of infectious waste currently falls on your government, your community, and your healthcare facility. And once you realize the sheer impact that improper healthcare waste management can make, it's very clear that the investment in a safe and sustainable healthcare waste management system is going to make good financial sense, as well as preventing a huge amount of unnecessary human suffering. International agencies do indeed recognize the importance of the problem and are increasingly integrating it into their work programs. The World Health Organization is now incorporating waste management into all of their water, sanitation and health programs. The World Bank, Gavi, Global Fund and PEPFAR have also increased their focus on waste, so that all healthcare infection control programs now need to include healthcare waste as well as water, sanitation and hygiene. But what does this mean for you? Well, healthcare waste management is notoriously hard to fund. But if your facility is putting in grants or programs that are addressing either infection control or water, sanitation and hygiene, then this means there should also be an element for healthcare waste management. And if this is applied consistently, it should go a long way to providing the resources, human and financial, that are needed. One international project that's trying to reduce the harm from healthcare waste management is being implemented by UNDP, Healthcare Without Harm, and the World Health Organization. The overall aim of the project is to implement best environmental practices and introduce non-incineration healthcare waste treatment technologies and mercury-free medical devices in 4 sub-Saharan African countries. That's Ghana, Madagascar, Tanzania, and Zambia, to reduce the harmful releases from the sector. We're currently in the first year of the project. All of the hospitals have been chosen. The master trainers have undergone 2 weeks of training on non-incineration healthcare waste management and how to substitute mercury in their facilities. And we're in the process of working out what equipment each facility will need. In the coming months, the mercury-free equipment will be distributed and the infectious waste treatment technology should be installed towards the end of this year. After year 2, we'll assess the success of the first round of implementation, and those countries or facilities that have been the most successful will receive a second tranche of equipment. In this way, we plan to maximize the impact of the resources that we have available. All of the facilities are also being enrolled in the Global Green and Healthy Hospitals Network, so they'll be part of this community. So we'll hope you'll get to know them and you can learn from them as we're going to learn from other members of the network today. Now, let's turn to some more practical matters, some important solutions to the healthcare waste problem. I expect most of you will be familiar with the waste hierarchy, which ranks waste treatment options from the best to the worst. So, although I always get technical questions about how to treat waste, it's always worth remembering the best solution to waste is prevention. And ways to reduce the volume and toxicity of a waste that your facility produces should be regularly reviewed. Resisting and turning back on the tendency to buy more and more disposable items can make a significant difference here. And don't forget to consider the whole life cycle of the products you use. The photo on this slide comes from a place in Patancheru in southern India, where earlier in my career I was doing research into environmental pollution. It has major impacts on the local population because of the extensive pharmaceutical manufacturing, and this is just one of many effluents that are going into the rivers. Also, in the UK, where I live, our National Health Service has discovered the largest part of its climate footprint came from the pharmaceuticals it used. So if you can reduce the amount of pharmaceuticals that you waste for any reason, you are not only reducing your own waste problem, but you reduce your contribution to climate change and help protect workers and communities in places that you may have never even heard of. It's also possible to choose less environmentally harmful pharmaceuticals from the Swedish WISE list, which is available online and regularly updated. If you're interested, we can share the reference for that at the end of this webinar. Next, we come back to the syringes, the cause of so much disease, as I explained earlier. There are basically two modes of thought on how to deal with these and other sharps. One group of experts holds the best thing is to put them into a sharp spot as quickly as possible. I, on the other hand, firmly believe that the most important thing is to, and the safest approach is to cut the needle and the hub of the syringe immediately after use. This has several advantages. First, it prevents those 10 to 20% of needle stick injuries that happen during the disposal phase, and it protects waste workers who are often among the poorest and most neglected members of society. Second, it prevents the syringe being used again, which could be a serious problem where criminal elements can rinse and resell them to unsuspecting customers. And thirdly, it produces a waste stream of high-quality plastic, which, once it's disinfected in an autoclave or similar technology, can be sold for recycling. I'm going to come back to that recycling in a minute, but first I just want to make a quick mention of occupational safety, which is so important. As I said, the waste workers are often among the poorest and most neglected of workers, so it's vital to take some basic actions to protection. Include them in the vaccination programs that are extended to healthcare workers. Make sure that all of the waste that is handed to them is properly segregated so they don't face unexpected hazards when they're handling it. Make sure they have the proper equipment, not the sort of thing that you see in this picture. And it's a very common situation worldwide. People often try and cut corners on this, but compared to the budget of the facility, it's a tiny amount of money, and they need it to do their work safely. Finally, make sure that they're trained. I've been shocked to find out that in some parts of the world, waste pickers think that the waste from the hospitals must be safe because hospitals are where you go to be cured. And I'm sure that some people that handle the waste in hospitals still have this lack of knowledge. So they need to fully understand the risks they're facing and how to deal with them. Now, back to those syringes. These are graphs are from a hospital in Nepal that we were working with for several years. And on the left, you'll see the orange is that 49% of the waste was plastic. That includes things like the cut and disinfected syringes, IV bottles, water bottles, and packaging. The slide on the right is the breakdown on the income from the sales, and it shows at this hospital 84% of the income is from those plastics. So this is something important you should consider when you're building a recycling system. Of course, you must include the paper, metal and glass. These are also widely recyclable, but don't forget the plastic. There is just one proviso. Make sure that it is properly segregated at source if you want to have a good price for it. Last year, Plastics SA said that the single biggest problem they get in recycling is obtaining a consistent waste stream. In the northern provinces of South Africa, where the demand of recyclables exceeds supply, up to 40% of materials had to be scrapped or rejected due to impurities. So the importance of segregation almost cannot be overstated. Besides syringes, one of the waste streams that can cause significant problems is pathological waste, and the largest amount of this is usually placentas. However, they and the kitchen waste can be disposed of in biodigesters of the type widely used to dispose of animal and farm waste. This not only removes an infectious waste, but food waste can also attract flies, cockroaches, and feral animals, all of which cause a nuisance and spread disease. The digester is seeded with cow dung and does not need any power to run it. Simply, as more waste is added, the treated waste overflows into the sewer or septic tank without the need for any further handling. The biodigester for pathological waste just has one extra design parameter. It needs 2 chambers, like the one in this design sketch. The pathological waste goes into the first one, and then the digested slurry overflows into the second, where the food waste is added. This is the most efficient design and allows the maximum residence time to make sure that any pathogens in the waste have died before the finally treated slurry goes out into the sewer. So that's the quick introduction I wanted to give you. The last thought I want to leave with you with is that healthcare waste management is a complex subject, and there may be more than one way of approaching the problems you face, be it disposing of the waste, treating it, or avoiding it in the first place. And it can be hard to keep up with the developments in the field. But there are some key steps that you not only help you solve your problems, but help others. First is from the GGHH community. Form a team and include them in your team. Make sure you have a plan for what you want to do. You don't have to do everything at once, but take steps, perhaps set up some recycling first, then improve your treatment technologies and so on. But whatever you do, make a plan, set targets, and record your story. And then share your story and share your knowledge with other people in this community. It's been my pleasure to do that this morning, and I'm very much looking forward to the other people who are going to tell us how they've been able to be successful in this field. Thank you very much.
Thank you very much for the presentation. Tshepo, I'm going to pass the ball over to you now. So you now have privileges to present, so if you can, let's see, there. If you can select the tab that has your name, you'll be able to find your presentation.
Yes. Okay. Thank you very much. My name is Tshepo Mokhadi, and I'm the Now, Practitioner is level 2 healthcare facility according to the South African National Department of Health. The hospital provides specialized secondary services and admits patients as referred by primary healthcare institutions and district hospitals. The services that are offered at Bongani Regional Hospital include physio, occupational therapy, psychology, lung function, and renal unit.
Bongani is situated at a Tabong location near the city of Belcom in the Free State province. The hospital can accommodate 450 inpatient beds. Our CEO here is Ms. Noche. Before joining the Global Clean and Healthy Network, there were several problems at the hospital. The first one, healthcare risk waste generation was not monitored and captured accordingly, meaning waste was manually recorded on the manifest document, which was not convenient. Secondly, waste was not labeled according to the source or point of generation. We could not identify or differentiate different waste sources. Thirdly, no waste strength or stats in terms of waste generation per ward, meaning we did not know which ward generated most of the healthcare risk waste or which ward generated the least of the healthcare risk waste. Costing of medical waste treatment cost was not done according to the cost center technique. Now there's a principle that is called the polluter pays principle, meaning each and every ward must pay according to the waste that is generated. Lastly, verification of waste collected and payment to the service provider was manually conducted. This was found to be not comprehensive and it was a time-consuming exercise. Now we joined the Global Clean and Healthy Hospitals Network for promotion of environmental sustainability in the hospital setup. It is important to note that the thing of employing EHPs at the hospital setup is a fairly a new thing. It started off in 2012 in our province, and the global provided a for that. Our goals were waste and on chemicals. And the purpose of this is our only focusing on waste. Now how we did our strategy, the sustainability strategy for our waste was that we developed the first version of the healthcare waste information system in hospital. This version consists of a Microsoft Excel-based spreadsheet, of which colleagues will see later during the presentation. The second version is the software-based application, which can be linked to portal for accessibility. Now, in our portal, we've got different systems for different departments. Like your HR people, they've got their own system that they are using for their data or stats. Even in supply chain, they are using for their stats. Now, also with the healthy waste system, we have created a system that can be used by the operational managers, the waste managers for the waste stats. The third version is the mobile waste app, which is in line with the eHealth Strategy 2016-2017, which incorporates the use of ICT or information technology media in the health sector. Now, this is the mandate of Dr. Mokhadi here in South Africa. We have successfully demonstrated the use of a functional healthcare waste information system at Bongani. Now, the system, what it does, it accurately generates reports, sets achievable healthcare waste minimization targets, because now we need to minimize the generation of waste. Now, the system will automatically set targets according to your generation. It also verifies the healthcare risk waste that is collected and payment to the service provider for healthcare risk waste management treatment costs. The system has been awarded the Alfred Nzo Environmental Excellence Award in the innovation category, meaning the Minister of Health was very pleased to see that there is a system that is being used by environmental health practitioners, and he said he wanted to roll out this system nationally. During the course of this year, the system will be rolled out in the Free State province for piloting. The challenge is that most of the healthcare facilities do not have the capacity to implement the system. For an example, they don't have the desktop computers in their final storage area where waste is being weighed prior collection and captured. Now, for you to use the system, you need to have a computer at your final waste disposal storage. But because of innovations that led to the second and the third version, there was a development of a cell phone or mobile waste app that was designed last year. This was done to repel or to get rid of the problem of the initial problem that we had, whereby most of the facilities could not have access to the desktop computers. Now, the skeleton structure of the app can be accessed at www.rajanell.co.za. Now, here I'm just going to show you the overview of how the system works. What can you look out for? The first one is the Excel-based sheet. Now, on the yellow column, that represents all the wards in the hospital. We've got about 31 wards or 31 waste here in Bongani. The second column, which is in the blue one, is the shaft column. Now, this one represents now the different categories that are found in Bongani. At Bongani, we've got about 3 categories of healthcare risk waste that are generated. It's called the shaft, the infectious waste, as well as anatomical waste. Now, we capture our waste on the red, and the white columns that are blend. In the red column, we capture the quantities of the consumables, your shaft containers, your boxes, we just capture the quantity. And on the white, we capture the weight. What the system does, it automatically calculates or add up the quantities as well as the weights that are being captured. Now, as you are capturing the weight, the system automatically generates the invoice. Now, this invoice will be used to verify the invoice amount as they come at the end of the month. It's important to know that in the waste management is outsourced, meaning the service provider that comes, we are no longer incinerating our waste. Therefore, the service provider will come, collect our waste, and then per kilogram, they charge us per kilogram. Now, we needed to verify those amounts that are being collected. That's why there is the invoice slide on the presentation. Also, the system automatically generates reports or graphs. Now, this graph can be used as your monthly report to the healthcare risk waste management team. You don't necessarily have to do the graph on the check the weight and the data. The system automatically generates the graph. There are some formulas there. And not only the graph, it also tells you how much waste is generated per ward and the amount of money. Because now each and every ward is a cost center. So we needed to find out how much waste is generated per ward and how much money is paid by that ward. So that when we plan our waste management, we must plan according to the waste generation. Also, the system, the waste generation per ward. You see the green. If you are on the green, it means you are minimizing, you are on par with the target. If you are on red, you are not reaching your target. So the system also automatically does that. It sets you targets that you must achieve. For an example, if you generated 20 kilograms of waste this month, it will tell you next month you need to reduce that. You should not generate more than 20. And it also incorporates the number of patients that you have. it takes that into account. We call it head counting. Now here is a software-based system. Now this one, you have to first click join in. You choose your hospital, your username, your name, as well as your password, and then you log in. Once you log in, you see that there are different types of ways that you need to select, that you need to capture. The important thing about the software is that it can be accessed by everybody who is using a computer. And also for the software, we've included almost each and every way. We make this system a living document so that you can not only capture weight, you can also capture some of the data that have been generated by the environmental health practitioners in the hospital. This slide now refers to the mobile weight app. Once you go into www.rajanill.co.za, this will be the first screen that appears on your cell phone or your computer, wherever medium that you can use to log in. Now you will see this first, and then it will ask, do you want to sign in? And then you'll have to sign in using your email address, and then you'll create your password. What I'm doing is that we've got a manual for the Excel-based system. I'm currently compiling a manual for the mobile weight app as well. Once all these manuals are being compiled, then I'll be able to share them with colleagues so that we can roll out this system. And I hope that this system will assist us in achieving good goals for environmental sustainability, as far as reducing the tonnages of waste that are being generated, especially in hospitals. I thank you.
Very much for the great presentation. Lukman, I'm going to pass the ball over to you so that you can present now.
Good day, everyone. My name is Shireen Arends. I am from Grace Hospital, Pietermaritzburg. Before you have the facility profile of my hospital. Grace Hospital is termed a referral hospital providing 100% tertiary level healthcare services, which is located in a city called Pietermaritzburg in South Africa. We provide a tertiary level healthcare service to 5 health districts that is around the city, which has an estimated population of over 3.5 million. The hospital is presently utilizing 507 beds with a bed occupancy rate of 84%, and we see an outpatient head count of 10,000 per month. We have a full complement of 2,106 employees at the hospital, where 1,900 are clinical staff. Our CEO of the hospital is Dr. KB Belinge. Our problem situation analysis. The number of healthcare risk waste generated at Grace Hospital became a very growing concern over the 2015-2016 financial year. Grace was generating an average of over 3,300 healthcare risk waste units per month, accompanied by an average of 98,500 cost implications per month for disposal. The waste management audits that were conducted identified poor waste segregation practices by personnel and patients alike. We have also identified unnecessary expenditure on excessive and inappropriate waste disposal because we did not have a recycling program initiated at the facility. We also identified insufficient knowledge by personnel and patients on the negative environmental and social impact. Grace Hospital became a member of the Global Green and Healthy Hospitals in May 2016 because we wanted to make a difference in the lives we serve, and we found that it is our social and moral responsibility to reduce the harm we are contributing towards, namely our environment and climate, and especially the people we swore not to do harm to. We chose waste management and energy as our two goals because we felt we have these two goals within our power to control, and we could make the needed changes. We also took into account the financial savings we will reap in the process. To start the sustainability project, I was appointed as the champion by our CEO, Dr. Blenge. I then developed two green teams, one for energy and one for waste, which comprised of 10 members and 5 members each. We then went out and started recruiting champions at the floor level, as we found that they are key to creating widespread change. A greening grace, which is now a slogan at the facility for our joining our membership to GGHH. We conducted an awareness day on the 25th of August 2016 to create awareness amongst personnel of Grace Hospital on the environmental and climate change, and also to sensitize the staff on initiatives that will be rolled out and introduced to reduce our carbon footprint as a healthcare facility. We invited external companies to come and showcase their greening initiatives, and also we invited other healthcare facilities within the city to come and also showcase their greening initiatives so that we could learn and also adopt good practices from each other. The event ended with our executive management planting a tree at the entrance of our hospital, signifying their commitment towards greening Grace. We introduced a 2-pedal bin system into all clinical areas, as shown in the picture on your left, and we mounted sharp containers closer to the end users. We also went further to create picture signage, because we have found that we had a lot of illiterate patients that were seen at the facility. And these picture signage would encourage proper waste segregation, targeting the personnel and also the patients of Grace. The sale of badges encouraged greening the planet were purchased and sold at the facility to ignite awareness of the greening Grace campaign amongst the staff. Before you will see a project that we have started in the operational theatre called the Diversional Wrapper Project. We found that a common practice in the operating theatre was to dispose non-contaminated sterilization crepe wrappers into the infectious waste receptacle seen in the picture below, instead of it being put into the general waste receptacle, therefore unnecessarily increasing the number of receptacles generated in the operating theatre. Also note, in our province, the facility is charged per healthcare risk waste receptacle and not by weight. And the picture below is the picture of a receptacle which costs us 28 Rand per unit. And this is how the Diversional Wrapper Project works. Large receptacles were placed in theatre for the disposal of non-contaminated sterilization crepe wrappers, which in turn are reused to wrap the facility's recycled receptacles. So as you can see, we are using them to wrap our own boxes that we were put in the different wards and departments as recycled receptacles. Before you is a slide showing our progress. Before August 2016, we were generating healthcare risk waste 2,842. Post-August, we have come down to 2,787, bringing us to a 55 units reduction per month. This slide represents the financial savings. Pre, on an average of 5 months, we were paying 83,000. Post initiation in August, we have come down to 82,800, bringing us to 601 reduction per month. Before you is a slide of only the red infectious waste bins I showed you earlier. Before August, we were generating 2,278 units. But post-August, we have generated 2,241, bringing a reduction of 37 units being rerouted from the landfills. The challenges we are now currently facing, as a government-stated hospital, obviously we have some budgetary lack of budgetary support, but we've opted for low-cost efforts like making our own recycle receptacles and also soliciting donations internally and externally for the project. We've also have constraints on time and workload. Staff favor the quotas, the status quo, and introduction of additional efforts were rejected before even the rollout. But what we have done, we have integrated the green strategies into patient care by initiating the 2-bin system and also adding additional shops containers to end users, and also giving regular feedback so people have more insight into the project. We've also have a problem or challenge, should I say, with the lack of awareness. Greening efforts are mostly seen as a young generation concept, and therefore the older generation are close off to the idea. But Funeka and I have introduced a very extensive training program that we have rolled out throughout the facility. And also we have introduced the greening pledge that will be said or recited at every functional committee at the facility. Lastly, is also our supply chain process that also that causes a challenge, where the head office has exclusive right over procurement, giving us sort of a challenge when procuring green-friendly equipment. Therefore, we have formulated a facility policy on procurement of products within our delegation to ensure that products are as environmentally friendly as possible. Our future plans are to roll out a correct recyclable program at the facility. We also plan to reduce dependency on paper by linking computer to mobile phones and monitoring the paper reams issued to wards and departments. We have set a target of 10% for infectious waste reduction and also a 10% reduction in all healthcare risk waste and a 10% reduction in cost disposal. We also plan to promote correct waste segregation at generation points and also increase in the proportion of waste recycled. Thank you, everyone.
Dima, I'm going to pass the ball over to you now.
Afternoon, colleagues. As I've been introduced to all of you, I'm Tshepo. I'm an environmental health practitioner from Bongani Hospital in South Africa. Thank you for giving me the opportunity to present and also allowing me to share the progress that we have made as the team of healthcare waste management in Bongani Hospital since we joined Global Green and Healthy Hospitals. Colleagues, kindly sit back and allow me to take you through our journey as Bongani Hospital. Bongani Hospital is a level 1 district hospital which was officially launched in November 2011 and the work's completion was done in August 2012. The hospital is located in South Africa, Gauteng province. We are in the Germiston area. The bed capacity of Bongani Hospital is 300 beds and we have a gateway clinic which is located outside the hospital. The hospital CEO is Dr. Nogwatse Mamjali Hatebe, also known as South Africa's youngest hospital CEO. The number of patients seen in our facility on a monthly basis is as follows.
Okay. Sorry for interrupting. Can you select your presentation? Because I think we can see the slides, yes. Yes.
I have selected the presentation. Can you see it now?
I can. Lukman, can you see it?
Can you see the presentation now, Ali?
I can't. But Lukman, can you confirm if you see it too or not, please? Lukman?
I am seeing the previous presentation.
No, Dima, we can't see it. What I'm going to do, if you don't mind, I'm going to take the ball back. You can still present, but I'm going to pass through the slides, if that's okay?
Okay. Yeah, go to the introduction.
Okay, great. Just tell me when to pass the slide.
Go to the second slide. Yes. Okay. Sorry, colleagues, for that. Exeter Hospital is a level district hospital, which was officially launched in November 2011, and the works completion was done in August 2012. The hospital is located in South Africa, Gauteng province. We are in the Germiston area. The bed capacity for Exeter Hospital is 300 beds, and we have a gateway clinic which is located outside the hospital. The hospital CEO is Dr. Negwate Mamjali Hatebe, who is also known as South Africa's youngest hospital CEO. The number of patients that we see in our hospital on a monthly basis, in the outpatient department, we see 7,674 patients. In the casualty department, also known as the accident and emergency department, we see 3,088 patients. In the admission department, we see 1,672 patients. The expected monthly average, according to the healthcare waste tender proportion 2016-2017 financial year, is 5,261.63 kg per month, with an estimated cost of 102,725.43 rand per month. Exeter Hospital Healthcare Waste Management Team comprises of the following members. We have 4 environmental health practitioners, 2 waste collectors, and 12 appointed waste team leaders. Basically, this are our nursing personnel and general assistants. They were appointed so that they can assist environmental health practitioners in terms of monitoring segregation practices and also conducting compliance audits within their sections. The problem of situational analysis in our facility is that Exeter Hospital was utilizing infectious waste boxes to discard infectious waste, and the monthly generation rates were above the recommended limit that is specified in the service level agreement between Gauteng Waste Directorate and Bushe Waste, which is our service provider for healthcare risk waste. And then other problems that were identified by the team is that there was overfilling of infectious waste boxes, decanting of infectious waste. By decanting, we mean that people will actually fill the big boxes and decant into smaller boxes, or decant from smaller boxes to bigger boxes. And then we had leakages of infectious fluids, and this arises due to the fact that people were not sluicing your urine bags before disposal. And then waste collectors were being exposed to economic hazards due to lifting of heavy boxes. And then there were unpleasant odors arising in patient cubicles and the central waste storage area when we were using boxes. These are some of the waste generation rates for Exeter Hospital from 2016 to 2017. You can see when you look at January 2016, we were generating around 7,531.26 kg per month, which was above the recommended limit. But currently, with January 2017, we're at 4,232.7 kg, which has decreased. And February 2016, we're at 4,214.75. And looking at February 2017, we are at 3,469.56 kg. And we have actually decreased our generation rates through continuous monitoring in the units, training, awareness campaigns, and also introducing different waste methods and programs within our departments. Okay, I'll take you through as to why we joined GGH and the goals that we have chosen. The goals chosen by Exeter Hospital is waste management and pharmaceuticals. So why did GGH join GGHH? We joined it to reduce the environmental footprint, to reduce waste segregation, waste management, which is reduce, reuse, and recycle. To reduce the health and environmental impact that are related to poor waste management, to comply with the national cost standards, to raise awareness and increase staff knowledge regarding the current development on waste management worldwide. And lastly, to also promote environmental health as a profession. Our sustainability strategy. Okay, we were previously using infectious waste boxes. So after identifying that we encountered through using the infectious waste boxes, we decided as the Better Waste Management team to phase out the boxes. There was consultation, there was training of staff members on the new system, which was introducing infectious waste brackets, which were mounted on the wall, and the infectious waste liners were hooked on those brackets. After that, we did an institutional gap analysis to identify existing gaps and also recording of monthly waste generation rates. There was consultation and piloting in the medical aid unit by phasing out infectious waste brackets as they were not working. As patients had access to discard their general waste, and also visitors were also discarding general waste in the infectious waste liners as they were situated in the cubicles. Then we sat as a team and decided that we need to phase out those brackets because they are actually contributing to the decrease in the generation rates. We started with the medical aid unit. We removed the brackets from that section, and then we advised the nursing personnel to hook the infectious waste liner in the nursing trolley, and also the doctors, we advised them to hook the infectious waste liner in their trolley. And actually, by doing so, nursing personnel and the doctors were able to segregate at point of generation, and patients only had access to discard their general waste in the general waste bins, which are situated in the patient cubicles. Okay, as you can see, picture 1 is where the installation of infectious waste brackets were installed in the wall, and then the brackets falling off, and then your nursing personnel were not closing these brackets after discarding in the infectious waste liner. And there was no accountability. Infectious waste liners were accessible to patients and other staff members, so general waste was still being discarded in the infectious waste liners. The success that we have achieved as Team Better Hospital, there's improvement in the waste segregation, there's staff accountability. We are at 98% compliance with the national cost standards. We have eliminated unpleasant odors in the patient cubicles. Staff members are more informed about the importance of patient. We have successfully conducted awareness campaigns. We have been awarded for effective contribution towards waste management in Gauteng. In 2013, a National Compliance Award in 2014 for the standard compliance, second runner-up award for the Naledi Service Excellent in Waste Management in 2014, awarded as the most efficient facility in healthcare waste management 2016 by the Directorate of Healthcare Waste Management in Gauteng Province. And then we have successfully developed a program where diabetic patients received 8-liter sharps containers to take home after receiving their insulin so that they can safely dispose their insulin in their home settings. And then after they come for their second visit, they return the containers to the facility so that we can dispose those insulin for them safely. And then we have a medicine return initiative where we educate our patients that they need to return unused medication and also medication. And we have currently developed another program, which is the recycling of bread tags. Our future plan as Better Hospital, we are planning to roll out more units whereby we remove infectious waste brackets from the wall, because currently we have challenges with those. They are falling off, and then there are unpleasant odors in the units due to disposal of waste within the cubicles. And then we are planning to host more awareness campaigns to develop Better Hospital waste management information system, to reduce the waste generation rates, to reduce needle stick injuries that occur due to poor disposal of needle, especially in the linen sorting area, We are planning to be at 100% compliance with the national cost standard and to create waste management manual and induction tool for newly appointed staff members. These are some of the campaigns that we conducted within our facility, whereby we're educating our staff members on the importance of segregation and also on the cradle-to-grave approach. These are some of the statistics that we managed to capture after conducting the waste management awareness campaign in February 2017, and 40% of our staff members were trained during that awareness campaign. Okay, and then we also have our internal recognition awards, whereby we award our most complying units. We do this on a quarterly basis. We give them certificate as a token of appreciation whenever they comply with during our audits. And then lastly, this is a picture of the award that we received from the Directorate of Healthcare Risk Waste in Gauteng Province for being the most efficient facility in healthcare waste management. Thank you, colleagues, for allowing me to present.
Then I'll just, there is one question, maybe Ruth, you can answer this one because it's coming in from Nepal and says, in Nepal, the management of healthcare waste management is not up to the mark. How can we improve this?
That's not a short answer. There are a number of things that need to be done. But the most important thing is that more hospitals need to take the lead of the facilities that have already done so. There are good examples in Kathmandu on what can be done. Segregation and installing autoclaves has allowed them to have safe waste management and to bring in back some of the funds through selling recyclables, and also to make substitute some of their cooking gas from the biogas that they have from the biodigesters. It's difficult to answer, such a broad question though. More specific, if you put that on an email, something more specific, I'll do my best to answer.
Then we have one question. Sorry, Dima, can you mute your microphone, please? Dima?
Okay.
Can you mute your microphone, please? I think there is some background noise.
Okay.
Thank you. We have another question. I think it's for Tshepo. How can we avoid or reduce the risk when using pathological waste to produce methane?
Yes, the one of methane, I don't understand because I don't do a presentation about the methane. But for the software, the structure, you can access it at www.rajanill.co.za. That's just the skeleton structure of the two. Colleagues must understand that I'm still studying through my master's. So after I finish my master's, then the fully functional mobile waste app will be complete. Then they will be able to access it as well as the manual. But the Excel one is easy. I've got a manual. I don't know how can I send the maybe through Lukman, I'll just give you the manual as well as the slides as well for the Excel-based system. I don't know if I've answered it correctly.
Our attendee that asked the question is clarifying that the question should be for the first presentation. So I'm not sure if that means Ruth, maybe? Okay, maybe we can follow up with that question offline. And then this is more of a comment for Dima. They like the idea about awarding certificates to encourage proper handling of waste. So just a comment from our attendees that they like that idea. And Lukman, I think that's it from our attendees at this stage.
All right. I just want to say thank you to everyone who attended and the audience out there. We're looking forward to another presentation very soon from our webinar series, and we should be looking forward to a chemicals webinar very soon, and we should be sending out an invite soon. So thank you so much, Ali, for hosting the webinar, and thank you to everyone for participating in it.
Bye.
All right, then. Bye-bye.